You're treating a fracture, and eventually that big question comes up. Doctor, has my bone healed yet? Many people think all it takes is looking at an X-ray, but bone healing is a biological process with several stages, and the image doesn't always tell the whole story. The bone goes through the inflammatory phase, then forms a soft callus, begins to mineralize, and eventually remodels. All of this takes time. To know whether a fracture has truly healed, the first indicator isn't the exam, it's your body. Pain gradually decreases, function starts to return, and that feeling of instability goes away. When the bone hasn't healed, patients often describe the area as loose or unstable. During the consultation, the physical exam is essential. I check for tenderness with compression, abnormal movement, or signs that the fracture site is still unstable. Sometimes the X-ray looks great, but the patient still shows clinical signs that the bone isn't ready, and that completely changes the approach. Of course, the X-ray helps a lot. It shows callus formation. In more complex fractures, or when plates and screws are involved, we also use CT scans to confirm bone healing. Another crucial point is time. Wrist fractures usually heal in 4 to 6 weeks, long bones in 8 to 12 weeks or more. If that period passes without clinical or radiological signs of consolidation, we investigate delayed union or non-union. But here's the key warning. Even if the X-ray shows a nice callus, that doesn't mean you're cleared to train or go back to heavy activities. The bone may be united but still fragile, and pushing too early can cause a new fracture or compromise the implant. And remember, it's not just the bone that needs to recover. Strength, mobility, and coordination also have to be rebuilt. That's why the post-fracture phase is just as important as the surgery or the cast. At UPhysio, you'll find protocols specific to each type of fracture, guiding your recovery safely. If you want to confirm your bone has healed well and move on to the next treatment phase, schedule an evaluation with me or my team. The link is in the description along with access to the platform. This was today's episode of Fracture in 5 minutes. In the next one, I'll explain when it's necessary to remove plates or screws after orthopedic surgery. Make sure to like this video, share it with someone who's recovering from a fracture, and subscribe to the channel to keep learning orthopedics with clarity and confidence.